We're going to start with sub-occipital release, and I'm using my fingertips, mainly these 6 is what I use. It's kind of hard to get in. You can sometimes get in there with the 4th. That's not a booger, by the way. It's a blood blister. So, okay.
You got any open wounds on your fingers?
No, no open wounds. So I'm right off the occiput, and I'm coming in here, and I'm really flexing my PIPs. The DIPs are kind of an extended. Now, I'm going to tell you, I want you to relax your head. Let your head be heavy. So I'm doing this little finger thing on both sides, getting the head just to kind of relax a little bit. Now, depending on the patient's flexibility and tolerance, they can tolerate this. Some of them can't, and they'll really just keep holding their head up, and you're going to need to give them more support, right? But if you feel like they can, if you're feeling like they're putting some weight into you and your fingers are sinking down, just let them sink. So you even tell them, take a deep breath. Take a deep breath, Johnny. Deep, deep, deep. Let it go, and let the head fall down. Let these fingers sink in. So I'm really going to be pushing here. So I also would tell the patients, the fingertips are like the fulcrum point on a seesaw, right? So here, relax back. So I feel like he's doing pretty good. I don't think he's giving me all the weight. So so why I've got my my thenar eminences kind of giving him a little more support right there. And then I'll do this side by side. Show this part right up here where I'm leaning side by side. Just right up here. So when I shift my body weight like this, my hands move ever so slightly, and so I'm getting just a little bit of rocking motion to the neck. Right? Helps the patient kind of relax. There you go. And I'll just do a little shake. So that's sub-occipital release, and I'll hold that for a few minutes. Okay, a couple minutes, a few minutes, maybe 2 to 4. The next thing we're going to talk about is dural stretch. So I'll come from this very position. If you'll come to the side, I'm gonna extend out my hands. I'm gonna give a little traction, and I'm gonna tell the patient, I'm gonna stretch you forward. I want a minimal to moderate stretch, not a severe stretch. So I'm gonna come up and take up some slack. Now, is that painful at all?
No.
Okay. So most patients, you want to plant your elbows on the table, and that way you don't have to work hard. And you're going to get to this position where your hands are kind of in this upward position. That's the best, easiest position for you to be in as a therapist. Okay. Again, you're telling the patient you want a moderate stretch, not severe, and nothing painful. So if it's painful, or if you feel like it's a severe stretch, we're gonna ease off. Okay. Sometimes they can't breathe. Sometimes they may have a hard time breathing. You okay? You having any issues, Johnny?
I'm fine.
Can you breathe? Okay.
I'm okay.
And so I'll sit there and do a little shake once in a while just to make sure they're relaxed. So the vector that I'm getting here, I'm flexing my biceps a little bit, my brachioradialis actually. And so basically having them in this position, I'm pushing his head forward, up toward where the wall meets the ceiling in front of us, and I'm also doing a little bit of distraction at the same time. And so I tell the patient I'm opening the joints here, and I'm actually stretching the wrapping of the neural tissues or the spinal cord. It's called a dural stretch for the dura mater, or the dural sleeve. And again, a minute or 2 here. Just a lot of times people will feel this down in the thoracic spine, mid-back, because of the trapezius muscles. It goes all the way from the sub-occiput to the T12. All right, so, and then you're gonna turn, always give good support, come back. And now usually I'll come in, I'll do just a little bit of like circular, I'm doing circular kind of motions here, like almost a figure 8. Just to get them relaxed a little, and then I'm on sub-occiput, and I'm doing traction, manual traction here. So my hands look just like this underneath, and I'm never trying to push with the fingertips. I'm trying to use as much space as I can on my finger pads. So you'll get a feel for that. We'll practice together, Johnny, over here. So you feel that compared to that, right? Now when I'm doing the sub-occipital release, yeah, I'm on the very tips. But when I'm doing traction, it's more of a touch, more surface area. Again, me as my body mechanics, I'm leaning back. I'm not just pulling here, right? I'm not using my arms so much as I'm leaning back, okay? Again, the therapeutic shake if they feel tight. And then I'll do some, so we're looking for restrictions. I mentioned that, right? So you're gonna come in, you're gonna just, and I don't want you to really worry about exactly what level you're at. You're gonna be upper, mid, or lower cervical spine, okay? So you're in the upper, right? I'm right off, you know where C2 is, right?
Okay.
So you're upper. So come to upper and you're gonna do some side gliding. You're gonna feel for restriction. If they're stuck, you're gonna push and it's gonna be hard. It's not gonna move. This side's gonna move, this side's not gonna move, or vice versa, right? So you just feel, you do some side gliding at a few levels on the way down. And you're feeling for what may be stuck. If you feel one that's really stuck and you can't push it, you want to come in and use this part of your hand right here, kind of just the side of the MCP, and you're going to do just a downward glide, pushing toward the opposite shoulder. It's kind of a 45 degree. That's the facet joint orientation up there in the cervical spine. So we're just kind of gliding. I'm actually putting a little pressure to the right to help close this joint and open the joints on the left. So if I push here and I meet resistance, that means these joints won't close. These joints on the other side on the left may not be opening, right? So he can't side bend to the right. If he can't side bend, he can't close here, he can't open here. One of those two is happening. So again, I'm trying to help by closing here, opening here. You can even come back in on this side and you could do a little bit of traction and pulling, and then pulling up. If you had a shoulder way up here, I'd be pulling at a 45 degree way up over here. Trying to open this side. Again, that's if I find restriction here. So if I'm doing this side gliding, it's called side gliding. You're moving one vertebra on top of another. If I push to the right and it's restricted, that means he can't do this, right? So I'm gonna come in and I'm gonna kind of close this one, push down on this one, and I'm gonna come in and push up on this one, up and over out here. Again, using that same part of my hand. So mobilization. So I'll come in, you can do them kind of slow, don't do them real fast. I mean, I did some about as fast as that right there. We're not trying to do any manipulations here. And then once you kind of do something directly like that with the side of your hand, you come back and do some more side glides. You can get way down in here, up right at C7, T1. You might even come down and lift them up a little bit and then get underneath that shirt. And I got my hand, I got that spinous processes right in between my first and second finger there. And now I'm taking up slack and I'm doing like a C7, T1 or T1, T2, mobilizing. Same thing on this other side. Come down. Okay. Sometimes all you got to do is just get them to relax. You might spend a visit or two early on just getting them to relax. Okay, so there's cervical. Okay. What part of cervical? You can hit stop.